Good afternoon, everybody. Before I start, I'd like to thank the many Nova Scotians who's offered their best wishes to me during my recent health event. I also want to thank the Club Inclusion. I have personal connection with Club Inclusion. I know the amazing work they do to support adults and youth with a range of disabilities. So I very much appreciate the tie. Thank you so much. I want to emphasize the Premier's message about balancing the reopening of Nova Scotia with protecting our health and safety. We're learning to live with COVID-19 while opening the economy and our communities, and we can to do that to support local businesses and allow people to get back to work and to other aspects of their lives. It's important for a range of reasons to allow the economy and society to reopen. But as we do this, we have to understand that it does increase the risk related to COVID-19. It's now, as we strengthen and further open things, it's even more important to continue with the public health protocols. And I can't emphasize this enough. It's critically important that people understand this, that the tools we have used to flatten the curve in the first wave are the same tools that we need to continue to apply to minimize the impact of any future appearance of COVID-19, and there will be appearance of COVID-19. They are what we have that will allow us collectively to keep things as open as much as possible. Physical distancing is where it's feasible remains a priority, and I'll explain more about that in a minute. Respecting the rules that are there for how we gather and form close social groups. It's important that people understand those and adhere to those. Continuing to practice hand hygiene and cough etiquette, focusing whether it's a workplace or in your own home or a public place around cleaning and ventilation, staying home if you're sick, and wearing a non-medical mask when you're in places where physical distancing cannot be kept. It's this package, if you will, of personal prevention measures that all of us need to follow. It's what we've said businesses and community organizations and workplace, it's what they need to put in place to support individuals who are coming into their environment to allow them to follow this package of preventive measures. These are the tools we have, as I said, will minimize the impact of COVID. If you like being back to work, if you like having our society and communities open, you need to follow all these rules together, because if we don't, we run a very real risk of having to go backwards. I'm going to expand a little bit on masks because we're strengthening that recommendation. To date, the public health advice for Nova Scotians has been to consider wearing a non-medical mask where they're out around other people and distancing may not be able to be maintained. This has been, I feel, an appropriate recommendation given where we've been in the last several weeks with our epidemiology. However, as we increase the risk for the virus to reappear, as well as a step to really strengthening our preventive measures and normalizing the use of non-medical masks before any reappearance does happen, we're now changing that to it's a recommendation that all Nova Scotians should follow. That we recommend that if they're in a position when they may be out and around people outside of their family and physical distancing cannot be maintained, then they should be wearing a non-medical mask. The example, so if you go to a grocery store or some other kind of retail environment, if you're in the mall, if you're on a bus, or if you're going to gatherings, unless you can be 100% sure that you're going to be able to maintain distance, you should be having a medical mask and using that. So it's important that Nova Scotians have a medical mask, that they carry it with them at all times, and that they use it when it's necessary and appropriate. The exceptions to this are children under 2, and there are some people who have medical reasons for not wearing a mask. And clearly then we have to accommodate them. But the vast majority of people are able to wear masks, wear them comfortably in safety, and we're recommending that they wear masks where appropriate. It's important to understand the mask, wearing the non-medical mask doesn't protect us as the wearer. It protects other people in case we have a virus that we're not aware of because we may not be sick. So wearing a mask really is a way of showing that we care about other people, and we ask them to wear a mask so they can care about us. Wearing masks together is a critically important piece of these preventive tools, and it's a very important way to clearly demonstrate how we're looking after each other. As I said, wearing a mask will be important when we go to gatherings, especially now that we're increasing these gathering limits. I'm going to expand on that just now. As the Premier said, our epidemiology is looking quite good. We've had no new cases of COVID-19 since June the 9th, and we have no active cases right now. However, that does not mean that the virus is no longer a threat. It could be here at a very low level, undetected, but as we're opening things up, we are having an increasing numbers of people coming into the province for various reasons. It increases the possibility of the virus being reintroduced back into Nova Scotia. So it's very important that we continue to respect the need to be around safety around COVID-19 while we open things up. So we're at a place now that we can increase the gathering limits to give more opportunities for businesses and Nova Scotians. So starting July the 3rd, recognized businesses or organizations can hold outdoor events with up to 250 people and indoor events with up to 50% of the seating capacity of the venue to a maximum of 200. The types of events that can be hosted are arts and culture events, special events and festivals, including weddings and funerals, and faith-based gatherings. I want to repeat that these expanded gathering limits are only for these type of events when they are run by a recognized business or organization. So, for example, a hotel is a recognized business that can host events like a fundraiser or a wedding in its ballrooms. A church, synagogue, or mosque is a recognized organization that can host faith gatherings of various types, as well as weddings and funerals. A theater is a recognized business that can host a range of arts performances. The responsibility is on the business or organization hosting the event to ensure that the public health measures are followed. For events that aren't run by a recognized business or organization, the gathering limit needs to remain at 50. So, for example, if you're holding a family-organized backyard wedding or a reunion, the limit is 50. That's because there is nobody to formally hold accountable for ensuring the public health measures, and we do not feel it's appropriate to have that burden placed on families. In all of these scenarios, physical distancing is still required unless you're in the same household or in the same close social group of 10 that we've used to replace what we previously had as bubbles. In addition, I really want to emphasize, and I'm going to talk more about these close social groups in a minute, but that if you're at any single event, you should be only in one single close social group. So let's say you go to a wedding with your family and maybe a few close friends in your group of 10. That's the group of 10 you stick with throughout the whole wedding. For anybody else, you need to maintain social distancing. We have to be. This is not a chance to say, okay, at a wedding I can now sit at this table of 10, and in a half an hour I can be at another table with 10. It's a single group of 10 per event. We're maintaining the limit of 50 for participants and officials at sports events, and physical distancing must be maintained. They can still be groups of 10 in closer contact within that large group of 50, but each of those subgroups, if you will, needs to be distanced from each other. Any sideline or bleacher spectators are included in the total of 50 people at a sport event. If we get to the point where sports competitions with spectators are possible, the gathering limits for indoor and outdoor venues outlined above will be in effect. There is much more information on these guidelines and how to host these types of events. It's been posted earlier today on our coronavirus website. I know that people are trying to plan a large number of events as we're entering summer, and I appreciate that many people are trying to get this right. We are in a large number of questions coming in various places in government. So many of them which we actually have information on our website that can answer those questions. So I really encourage people to check out what's on the website first. The newly posted document will certainly help as a first step as you try to figure out how you can host an event while sticking to the public health measures. With each event has its own unique variations that you need to figure out. And also, a lot of the questions coming really ask people to think things through, use common sense, and err on the side of caution. If you're not sure, take the cautious approach when working out the details for your specific event. I have a few other announcements, but first I want to clarify what we mean by a close social group of 10 that came into effect last week. It replaces the concept of the family household bubble. I'm hearing from a lot of places that people are confused about what this means, so if you allow me a moment to try to clarify that. The idea behind this is to allow more close contact for social purposes, but to do that in a safe way. So people need to choose very carefully who's in their group of 10, thinking about their own circumstances around are they in a work situation that puts them at increased risk of exposure? Do they have their own personal health risk because of age or medical conditions that will put them at greater risk for severe COVID-19? What about those same factors for other people in the group? We're asking people that you can choose who's in your group of 10, but again, this is limited. Ideally, people would have a single close social group. That's who they have the close social interaction with. But at the very least, people need to be thoughtful about how many groups they are in. People should not randomly, spontaneously just become a group of 10. So this does not say that you're just out and about and you happen to come across a group of friends and say, okay, now we're all going to go out to dinner. Because you know what? Each of those people probably have the already established groups of 10. So creating these close social groups needs to be done carefully and thoughtfully in a planned manner. I'm hearing too many circumstances, even the last week, where people are just saying that kind of the rules are off and now we can just go out and socialize like before. It's not intended for this. That puts us at too much risk. So the close social groups are to be planned carefully and thoughtfully, and people need to think about very carefully about how many of those they introduce into their lives. Businesses and organizations should not set up seating for groups of 10, for instance, and just randomly seat people. So, when you're hosting an event, groups of 10 that are preformed can go to, say, the theater, but the theater is not be setting up and we're going to have a group of seats of 10 here, and 10 people come. The next 10 people coming through the door are going to go sit in that. This is for predetermined groups of 10 as they go out, whether it's to a restaurant or to a gathering. Certainly, if you're hosting a concert or a church service or something like a bingo, we want people to accommodate the preformed groups of 10. But also, it doesn't have to be 10. So we also need to think about how you accommodate smaller groups. People had a predetermined who they want to get together with. So it doesn't have to be 10. I need to emphasize that as well. The close social group does not apply to workplaces. For example, it doesn't mean that 10 people should get together in a meeting room without physical distancing. Because again, if everybody in that room probably already has one or more close social groups. So we don't want to just mistakenly add another group of a close social group of 10 into their lives. So as much as possible, the primary objective should be to maintain physical distancing. And in the workplace, these are close social groups. They're not intended to be for the workplace. However, we know that there are certain businesses that because of their size, that if they cannot maintain social distance, they can have up to 10 clients or customers in their retail space. That's different than the close social group. There's more information on this on our website, but I hope I've been able to clarify the intent behind the closed social groups, and through some examples clarify what is really allowed and what should not happen. I'm going to end with a few more announcements that the Premier has spoken to, but it bears repeating that as of today, restaurants and licensed establishments can now operate at 100% of their capacity while maintaining the appropriate physical distance between tables, booths, and seats. It doesn't mean they go back to 100% capacity before COVID. We've said restaurants have had to space out their seating to maintain distance. So within that established spaced out seating, they can now have 100% of those tables filled. They can provide service up until midnight, but must close to patrons by 1 a.m. and that's for all restaurants and licensed establishments. And they must continue to follow all the other aspects of their sectoral plan. Private campgrounds can now open all of their temporary campsites. Up until today, they can only have half of their temporary campsites open. Now they can have all of them. And like elsewhere, pools, beaches, and playgrounds at private campgrounds can now be open. And they too must also follow all the other aspects of their sector plan. People living in homes funded by the Disability Support Program can now resume going out into their communities, whether it's for socializing, for visits with families, or many of them have job opportunities in the community. I ask people to be patient with that because it may take some time for individual homes to make these arrangements safely. Public pools can reopen with physical distancing for lane swims and aquafit classes. There can be one or more groups of 10 appropriately spaced for other activities such as swim lessons or open swims. And the number of those groups, it will be determined by the pool size. And the private pools must follow the Nova Scotia Life Saving Society has a detailed plan for change rooms, for washrooms, and that is the sectoral plan for public pools that must be followed. Along with the playgrounds that were open last week, I want to clarify that splash pads, we're saying they're the equivalent of a playground, and they can also be opened. I'm getting some questions about, well, if you're at a swimming pool and there's chlorine in the water, does that safely kill the virus? It doesn't. The concentration of chlorine that would need to be used to be able to kill COVID-19 is far greater than the safe concentration of chlorine in swimming water. So it's very, very important that people follow all the other safety measures if they choose to go to a pool. Don't rely at all that the chlorine in the pool is going to provide you any safety against COVID-19. I know we've covered a lot of information today, a lot to take in. We will have an opportunity for questions in a minute, but I want to end by just making a few, I guess, more thoughtful remarks. Every day that we have no new cases, I think people are getting more and more of a sense of relief and want to get back to normal. I understand that. But I don't want to rain on your parade, but I can't say strongly enough or too many times that this isn't about going back to our pre-COVID normal. As we open up the economy and society, we run a very real risk of COVID-19 resurgence if we don't continue all the core public health measures. As I said before, the tools that we flatten the curve with are the tools that allow us to remain as safe as possible, allow us to have our businesses open, allow us to have our communities open. If we don't, we've seen it happen in other places. What happens? So we can't let our guard down. Our new normal is practicing all these public health measures, and it requires all of us to be practicing them. As I've said before, we look at other research. It only takes a small minority of the population to kind of let their guard off, and it puts all of us at risk. So we have a collective obligation to protect each other, and all of us follow the public health measures. We know that we are asking Nova Scotians to find their own balance in this new normal, but we also need everybody to continue to be vigilant about the physical distancing, hand hygiene, staying home when you're sick. And I'm going to repeat one more time that we are now asking Nova Scotians that if they are in a situation when they're out amongst other people and they can't be assured of maintaining the 6 feet physical distance, then our strong recommendation is that they should be wearing a non-medical mask. It's all this package of things together that will allow us to keep each other safe and keep things open as much as possible, as I've said. Much of what is the months ahead will look like is in our control, but only if all of us stay focused on the personal prevention measures that I outlined earlier. Our collective efforts will make a difference, but we all need to be thinking and acting for each other. We need to continue to think about caring. It's by practicing the preventive steps, where it's actually a sign of caring, that we're protecting each other by taking the time and the steps to all the things we've outlined. Those are for ourselves, but even more so they're for each other. So I would ask people to think about each other and that act of caring by keeping each other safe related to COVID-19. The sense of community. It's that by being together as a community, having a positive approach. It's unfortunate I've seen some division happening, that people are taking a negative approach about, there's kind of two camps, that we're going too fast, or people saying we're not going fast enough, and they're blaming each other. People are angry because they see somebody not doing what they think they should be doing related to the rules. It's much more constructive if we stay positive and support each other. Think about this as approaching each other with compassion, not judgment, creating a positive community, not a negative community. And lastly, my third C is around common sense. There's lots of rules out there, lots of questions, but think about this, use common sense and err on the side of caution if you're not sure.